2015 was an unprecedented year for innovation at NHS Leeds CCG. All our 37-member practices were, and continue to be, engaged in co-designing, implementing and evaluating an ambitious and transformative enhanced access scheme to improve access to primary care GP services for our patients. Our 37-member practices serve a total of around 360,000 registered patients. Out of these, around 50,176 are over the age of 65 and 60,739 are 16 years and under. Before the scheme was rolled out, in our area we saw 92,520 patients from West Leeds attending A&E in 2014-2015. And out of these, in an average month, 6,714 people called NHS 111. 3,555 ambulances were called out and 1,600 made use of a minor injury unit.
Our aim was to reduce the number of people accessing urgent care services out of hours, especially A&E, by rolling out a £9 million scheme over 18 months to extend GP practice opening hours. Our scheme has invested in increased capacity to offer GP primary care services new ways of working, provided headspace for practices to transform and lay the foundations for extended access, supported a practice nurse training programme, created a productive general practice programme, created a GP quality improvement and medicines optimisation scheme, ensured we can provide a named GP for over 75s as part of a multidisciplinary team approach, created the foundations for a new strategy for out-of-hospital care, including wider primary care provided at scale, as well as preparing the ground for new models of care. When setting out this project, we had to take into account the area that NHS Leeds CCG covers. These are inner city to leafy suburbs, large numbers of students and working-age adults in comparison to the other two CCGs in Leeds, mixed deprivation levels in the area, with some affluent areas as well as some of the poorest neighbourhoods in the country, the needs of certain demographics such as offender health, and meeting the challenges of diverse groups such as the gypsy and traveller community.
The partners of our practice are covering the Saturday morning surgeries, so that's a positive step. So patients that perhaps want to see a GP on a regular basis can book well in advance to see them on a Saturday morning when they're doing their sessions.
I've noticed that the workload seems to have levelled out more. You know, there's not a mad rush where people, you know, sort of need to be seen sort of on a Monday or a Friday, so that we can then, you know, sort of spread our workload a little bit more evenly.
The Extended Hours scheme was developed in partnership with our 37-member practices and approved by a specialist panel with no conflicts of interest. It consists of 2 levels. Level 2 offers extended services over 5 days, of either 7 a.m. to 7 p.m. or 8 a.m. to 8 p.m. This has been implemented across 18 practices and covers 194,000 of our population. Level 3 delivers a more enhanced service, offering patients access to GP practices 7 days a week. It has been implemented across 19 practices and covers 156,000 of our population.
When the enhanced access started back in 2014, there were discussions with neighbouring practices. There was some relationship already there because we'd got GPs who'd been trained by neighbouring practices, etc. However, talks about perhaps moving to 7-day opening started within our locality. And whilst as yet we haven't done 7-day opening, we now work a lot more closely with 2 other practices within the Armley area, and we have formed a federation now with those 2 practices.
To talk about one of the challenges that led to one of the benefits, it was difficult to kind of get a sense of shared vision. to see what might be possible. We saw ourselves, all in our separate practices doing our 8 a.m. till 6 p.m. services, and it was difficult to kind of see the end product. And I think because we didn't have any prior experience of how we would do that. And so I think one of the benefits is we know that we can do more. We know that we've got the resources and the capability to get together, get our collective heads together and come up with a solution that benefits our patients. And that's the greatest thing. We know now that if our patients need to see a GP, they can do that between 8 a.m. and 8 p.m. Pretty easily.
Once the scheme was rolled out, we promoted the extended opening hours to our patients through direct mail, information leaflets and posters, pull-up banners inside GP practices, website banners, social media such as Facebook and Twitter, out-of-home advertising and street teams, and articles in local press and radio.
Since the scheme began in November 2014, we've seen an overall increase of people attending GP practices by more than 125,000, at a cost of £36 for each attendance. There has also been a 3.7% decrease in people attending A&E, and a 20.3% decrease in those attending out-of-hours services. There has been a 0.7% increase in people calling 111, but also a 1.2% fall in people attending the minor injury unit. Our two in-depth patient experience surveys show an increase in satisfaction with access and opening hours from June 2015 to January 2016.
Our patients love the fact that they can come on a Saturday morning and later. It's easier for them to get appointments because part of our enhanced access was obviously making more appointments available through the day as well, not just out of hours and on a Saturday. So we've made more telephone appointments, we've restructured the way that we offer appointments through the day.
The general feedback has been very good, and we've gauged that by getting a group called Health Watch Leeds in to do some focused engagement with our patients. So they literally came for an afternoon and sat in the waiting room and spoke to people. And the feedback that we got about it is very good, and that it is working for people's busy schedules, and perhaps that it gives some level of assurance that there is some availability there. I think there's sort of a prevailing narrative within the media that you can't get to see your GP very easily, and when you go it's going to be a strange stretch service that you're probably not going to enjoy. I think people are finding out that that's not the case.
We've done it. We've done a lot of promotions. You've got posters behind me here. These posters are sitting in all the surgeries. We've leafleted the patients. We've got a mobile phone thing called MJOG that we send messages to all the patients that we've got mobile phone numbers for, to tell them that appointments are available on Saturday and Sunday. We're emailing patients, so there's been an awful lot done. In the general papers and things, even then there's been some advertisements.
My practice contacted me by email to let me know about the change to the practice hours, and I feel they're very good at keeping me up to date with any changes that are happening in the practice. I'm very happy with the extended hours that the surgery has introduced.
As I only visit the practice every 6 months, I didn't know about the extended hours until I rang to make an appointment. The new system was briefly explained to me and I was given an appointment for that day. My practice mentioned the hub and spoke model, and once they explained to me how it works and its benefits, I'd be very happy to visit another GP practice, as long as it's only walking distance from mine. I work from 8 a.m. to 6 p.m, and hopefully it will be much easier to make an appointment, and I'll definitely use evening and weekend appointments.
I have a number of long-term conditions, and I want to continue to see my own GP, as it works better for me, because then I won't need to keep repeating my symptoms to another GP. The practice explained about hub and spoke, and I'd have to say that I don't feel that would work for me with my long-term conditions. But if I needed a day-to-day appointment, I'd be happy to take one of the first available appointments and would be happy to travel to a local practice. The model would work very well for my husband, who works full-time and is 30 miles away from the surgery. Evenings and weekends would be really beneficial. I'm very happy with both the staff and services at my surgery. The longer hours and access to other local surgeries would make access to appointments easier and stop people going to A&E.
Overall, we've learned that allowing commissioners to create the conditions for providers have helped them to flourish. But in order to improve, we need to secure investment to gain a longer-term commitment. We also need to improve capability in business intelligence, organisational development, and build a long-term workforce with a large skill mix, and give training for flexible teams. So what's the plan for the future? Our aim is to use innovation through technology and further open up the practices to the community and each other. We're going to promote online services more, improve use and uptake of the Leeds Care record, and integrate video calls for consultations and clinician-to-clinician communication. On top of this, we plan to continue Level 2 weekday 8 AM to 8 PM in practices and expand Level 3 to all neighbourhoods. We're also going to consider focusing on those at risk of admission, which should facilitate early discharge.
In summary, our practices have shown an appetite to delivering 7-day services. Patients that do use the service value it. It's currently too early to understand any clear changes in patient behaviour. Return on investment is hard to demonstrate, but it does have the potential to generate £1.8 million in savings over the next 6 months based on early indicative data. Measuring the scale of improvement is challenging, and we know there is long-term investment needed in people, technology and data, and we need to give time to ensure we can fully embed and evaluate this approach.
The IT has been a major problem because most practices use one of two systems. We either use System 1 or EMIS, and neither system talks to each other. So that has been a major problem, trying to get different surgeries on the same computer screen but using different systems. And then we also had to train the staff and train the doctors themselves.
We had and still have really issues around indemnity insurance for healthcare professionals, and that's sort of, if you like, car insurance for healthcare. You know, if something goes wrong, you need to have the support and the resources to help you to figure out that challenge and do what's best for the patient and to make that right. And so changing the profile of how that service is delivered is something that the indemnity companies haven't really got their head around yet. They haven't really got a product, and I think that it feels risky for them because it's unknown to them.
The CCG has been very useful and have interacted very well with us. In fact, it was a refreshing change for once that our views were sought and we felt listened to.
I'm very positive about the future. I think I'm very positive about the future in Leeds West, basically, because we've got a very good CCG that's very proactive with us. But also, I'm a glass half full person, and I think for the first time for a long time, the clinicians and primary care have been allowed to grow themselves and without too much red tape around them. So we'll be able to take ideas, go with ideas, see if it works. And and so far a lot of our ideas have worked.
As a surgery and as a federation, we would like to move it forward to 7-day working. However, what we don't want to do is destabilise any practices within our area that may not want to do that. So it's very important that we work together as a wider locality.
This has really kind of proved a few things. First of all, that we could do it, that we've got the resources and the ability to deliver this kind of enhanced scheme where we step outside of what we know and what we do normally to do something bigger, something more, something that's delivering, you know, an added measure of value in terms of the experience that we give to our patients. But it's just a start, really. You know, it's quite a basic scheme. It's just about extending GP services into another part of the week. We haven't really even gotten into how we're going to deliver focused cares that meets the specific health needs of our population.